Let's talk about all of this right now with Danny Mortimer, who's Chief Executive of the NHS Confederation. Good morning to you, Danny.
Good morning, Julie.
Good morning to you once again. Really appreciate you joining us. There's a lot of good news here about what's going on in terms of vaccinations. Not so much good news when we talk about the number of people who are in hospital with COVID. Tell us how bad things are.
So as you said, Julia, the stepping up of the vaccination programme is remarkable. And as the supply of the vaccine, particularly the new vaccine that was approved just after Christmas, becomes more secure and more predictable, the vaccination programme will ramp up even higher. But a remarkable progress. 4 million people vaccinated now, and a stretching target to meet by the middle of February. But massive work being done. You are right. At the same time, the NHS a year ago had 4,000 critical care beds. By the end of today, it will probably have the best part of 6,000 critical care beds. And that stepping up of the facilities in which we care for our sickest patients is as a consequence of managing the virus and managing the demand for care that we see from many people who are admitted to hospital. At the same time, of course, we've also seen enormous impact on the number of patients waiting for other treatments in the NHS. And that's the issue that we're going to have to deal with after the pandemic, after the vaccination programme has made it much more possible for us to manage coronavirus in the community. We've got many years of work then to recover the waits that have been caused over this last 12 months.
You and I both know that many of those people who are waiting won't actually survive as a result of those long waits. But we'll come into that because there's no doubt at all the NHS has had to ramp up. The NHS was predicting from the summer there would be a second wave. Boris Johnson was saying we'd be back to normal by Christmas. Clearly not expecting a second wave. £3 billion was given to the NHS to prepare. Why, though, and we've spoken about this before, why were the Nightingale hospitals not reopened? Why were more staff not recruited? Again, I've spoken to even more people over the weekend who they themselves and they know other medics who volunteered to return. They've been filling out, a week's worth of online courses and paperwork to try and return. They've not been called up to help. We're told that the NHS staff are overwhelmed, that they can't cope, they're stressed, they're tired, we haven't got enough people to deal with the people who are in critical care. And yet you've got, thousands of people saying, hi, I'd like to help, I'm medically qualified, I've retired only a year or two ago from a consultant level job, I can help, who've not been called up. There are some issues in terms of the NHS's decisions how they went about preparing for this, is there not?
So there's a few things there, Julia. The first in relation to the vaccination programme is that process in terms of recruiting people and making sure they're properly trained to give the vaccinations has rightly been
even to come back to work in hospitals.
One thing at a time, Julia. Let me talk about the vaccination stuff first.
No, but I want you to talk about hospitals.
Clearly, I will. Clearly, what was expected in terms of that training was excessive, and it's been simplified. As the supply of the vaccines improves, more people will be drawn in to help with the vaccination programme. In terms of the issues in hospitals, what we've seen is that absolutely the NHS prepared to open the so-called surge beds, those extra critical care beds I talked about. What it's found is that doing that within hospitals, within the 200 plus trusts around the country, has been much more effective than the Nightingales. It's enabled us to concentrate people within our institutions. Many people have returned to practice. Many students have left their studies or alongside their studies have come to work in the NHS. What we've needed, particularly what we've seen as a particular stress point over the Christmas New Year period, is critical care. Highly specialist, highly trained staff being asked to care for more patients. It takes many years to train those colleagues to look after those types of patients. Lessons are being learned all the time in terms of our processes and how we draw in people to help us. But in those areas in particular, we're concentrating our highest trained staff, our most specialist staff rather, in terms of looking after those kind of patients. But they're having to look after far more patients than they did before the pandemic. More
patients, and we're told sicker patients. And a number of people working on this also have claimed that we're seeing younger patients. The statistics that I've seen a number of different statistics and got experts to have a look at them to see, am I misreading them? I don't claim to be an expert in this field. That there is no evidence that people are any younger who are being treated for COVID right now than they were during the first wave. But we also know that people who are younger and this is not in any way to say their lives aren't valuable or they shouldn't be saved or anything like that. Please don't anyone read into that. But it's nevertheless the case that they are invariably with a number of very serious underlying conditions, nearly always related to morbidity, being morbidly obese. And this is a very, very big issue, which is also one of the things that's created extra problems for ICU wards, which is that patients need to be turned regularly, and we're looking at trying to turn, a 30-stone patient is a rather bigger affair than a very frail elderly person.
So I'm not a clinician, Julia. What I think my colleagues are reporting is that over the course of the pandemic, over this last 10, 11 months, our ability to treat patients has improved due to the work that they've done. So more people are surviving the virus because of particularly the use of dexamethasone. I'm not sure, like you, whether we're seeing younger people now. What people are reporting is that there have been throughout the pandemic significant numbers of young people who have become ill. Some of them do have underlying health conditions. Sometimes that includes obesity, as you've rightly said. They are more likely to recover. They're less likely to die than someone who's over 80, which is why our over 80 citizens are being prioritised for the vaccine. What we are seeing, of course, is those people who survive the virus. A significant number of them, are also reporting symptoms long after they've been discharged from hospital. And we fear, and what we're seeing through some of the early work on long COVID, is some serious damage to people's internal organs, their lungs and other internal organs. And that's a real concern for the longer term as well. So you may be less likely to become very seriously ill. You may be less likely to die if you're my age, in and around 50. But actually, you may have serious consequences for the longer term. And that's something we're going to have to manage as well.
Oh, absolutely. Is there a case that actually, in some ways, the NHS can be a victim of its own success with these new treatments, with the knowledge that has been gained over the last 10 months in terms of treatment, that actually we are seeing the NHS keeping more people alive. They're staying therefore in ICU often longer, in hospital longer, but those people thankfully have not died. But that's contributing to that pressure on the NHS, which is that people are in ICU, they are in critical care beds, they are also in hospital for many weeks after they've been released from ICU, and that is creating a lot of the pressure.
I understand the point you're making. I think what we see is a much higher rate of infection, a much higher rate of admissions into hospital than we saw back in the spring. And I think that's the single biggest cause of the pressure that we're seeing right across the UK, is that higher instance of infection, which we know leads to more serious illness and obviously leads to real harm being done to people. The fact that we're able to mitigate that harm, that our clinicians are able to reduce some of that severity, and I appreciate it's only some of that severity. Yes, we're getting better at doing our job in terms of caring for patients with COVID, but the sheer number that we're seeing attend our hospitals, particularly in recent over this last month, that's the key cause of pressure, and that pressure is being felt then elsewhere in the system as well. We've talked previously, Julia, about the kind of impact that we're seeing on the ambulance service and the disruption to their treatment. We're seeing the impact that there is in terms of our services that are provided outside of hospitals as well. Okay. Despite all of that, the vaccination programme is progressing magnificently, and despite all of that, we still need people to come to us if they are worried about other symptoms, and particularly worried about people who suspect they may have cancer or other serious conditions. We still need them to come to us. We still need them to help us help them for the longer term.
Cannot stress that enough, because again, although we've got excess deaths from COVID, we have below normal levels of death for many other things, including heart disease and the like. And we've got to wonder, where have those people gone? Danny Mortimer.